Thank you for joining us today for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabert Schuster, State Director for AARP in this territory. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering Americans 50 years of age and older to choose how they live as they age. With nearly 38 million members nationwide and 22,000 members here in the territory, AARP works to strengthen communities and advocate for what matters most to families, with a focus on health security, financial stability, and personal fulfillment. As a trusted source for news and information, AARP in the Virgin Islands utilizes this platform to highlight key subjects of concern to older Virgin Islanders and their family and friends. That's why AARP VI has invited Barb, Michaud and Anique Harrigan from Cancer Support of the Virgin Islands to join us on today's episode. With Breast Cancer Awareness Month fast approaching, AARP wants to make sure Virgin Islanders are aware of the support services available locally for families battling this disease. And so we welcome Anique Harrigan and Barb Michaud. Welcome to the show today.
Hi, good day.
Thank you for having us.
Thank you. Thank you for joining us and bringing us important information about the cancer support of the Virgin Islands. I've heard just a little bit about it. As we are aware, it's a small organization, and I'm sure that there are a lot of people in the Virgin Islands who are not aware of what this great organization does. So I'm happy for you all to be here today with me to share information. So starting off with Barb, just tell us a little bit about the history, or the full history really, of cancer support of the Virgin Islands, and how did it get to where it is today in this territory?
Yeah, thank you for thank you for having us. I apologize. I have a cold, or actually, yes, I have a cold. But Cancer Support VI was started in 2005 by the former director of Cancer Support VI, Charlene Kehoe, where she went to the Stevenson family and their businesses at the time and said there needs to be some support for cancer patients. So Mr. Stevenson invited cancer patients and Charlene to come to his home. And from there, it spawned the opportunity for education. And then there was the realization that there needed to be a hospital. And after a year, Charlene went back to the Stevenson family and their businesses and said, what can we do to provide financial assistance? It is then that the tides changed and the Stevenson family began to pour their funds very generously in supporting and finding a way to provide financial grants for cancer patients. So within that 17 years since its inception, I could be wrong, Anique, we have served, do you know exactly how many we have served? I know I should have that answer. I believe it's like we've raised over $2.5 million, I believe. Right. And we have helped, I would say, very close to 3,000 cancer patients in that time. What's really important to know about the organization is it is, although 100% of every dollar raised, if Anique and I do nothing today, we share with you some courageous stories about what cancer patients face in the Virgin Islands without a cancer center currently, and that 100% of every dollar raised goes directly into the cancer patient hands. We are so gifted that most nonprofits aren't able or aren't in a position to do that. So the Stevensons donate every year to cover my salary and Anique's salary. So I think that's important to kind of note. And all of them, if we wouldn't be where we are today without our private sector. It is our private sector that is the guidepost to all the fundraising that we do. Charlene used to do a very successful annual gala where it would yield anywhere from $150,000 to $200,000. And then In 2013, I was diagnosed with breast cancer, and in 2014, I went back to my employer and said I want to pay it forward. Charlene had assured that I shouldn't be ashamed for asking. That is something important for Virgin Islanders, are very prideful about asking for help. And she made it very easy and made me not feel alone. So anyways, fast forward, Mahogany Run was able to raise almost $75,000 in 3 years until Irma Maria. So this community continues to wow us, and it is our private sector that continues to yield for us. We couldn't do it without them. We absolutely couldn't do it without them. We do now do a Pinktober, which is coming back upon us. As you can imagine, during a pandemic, we couldn't do any in-person events. So last year we got super creative and reached out to we looked for $10,000 donors. It was a needle in a haystack that we would find $10,000 donors. At the very end, when we only had 9 $10,000 donors, we went to a realtor, and that realtor got 10 realtors to give $1,000. It's amazing how people pull together. And every dollar raised last October was matched up to $100,000. And I think we raised almost 240. Thanks to that and our community, we were able to increase the grant amount for what we give a cancer patient. We are the #1 nonprofit organization in the Virgin Islands. There are other amazing organizations that raise awareness and funds for different cancers and or for cancer. But we are the #1. I think Anique can speak to more the patient grant piece and the amounts.
Inspirational story, but before we get into the particulars of how people tap into this resource, tell us a little bit about the Stevenson family. Are they Virgin Islanders? Do they live here in the territory? Do they have business here?
They do, and Anique can piggyback off of this. I don't know exactly, Anique, do you know when the Stevensons moved here and started International Capital and Management?
I'm not quite sure, no.
So they started International Capital and Management Company, which is in St. Thomas. And so that was one of their main businesses. Now they have International Private Bank. So they are 2 entities that are in the Virgin Islands. The Stevenson family has many entities in terms of their family members that live here quite a bit of the time and give mostly of their time and or their resources to help this organization. They're also amazing donors for other organizations. Their belief at the core is philanthropy. They are the originators of Cancer Treatment Centers of America. And I believe it was I think it was Mr. Stevenson's mother who died from cancer. And they tried desperately to find services for that wasn't available. And that just inspired them to say that was unacceptable. And so they created these hospitals. And we just piggyback off of that mission vision of leave no cancer patient behind. So I don't know if that helps, but the Stevensons have long journeyed with the Virgin Islands and remain extremely committed to a long-term plan.
Yeah, that's wonderful. That's really, really kind and very generous of them to provide this funding to help so many people. And you mentioned Cancer Treatment Centers of America that they founded. So it begs a question: when people receive these funds for cancer treatment, are they required to spend the money at Cancer Treatment Centers of America, or can they go to any healthcare provider they choose?
Not at all. They can go wherever they choose. Some people go based on where family is, but some people choose to go to Cancer Treatment Centers of America.
Okay.
Yeah, it isn't not. We're the one. We provide a financial grant. We provide hopefully support resources, but we're never yielding to someone's treatment plan or their protocol. The one thing I think Anique and I have tried to support we have local oncologists. I think nationally without our cancer center, people are thinking we don't have support here. And we do. We have, we have St. Croix cancer specialist, Dr. Ellie Del Giaco. She also has the practice over here with Dr. Errol Hobdy. And there's Dr. Bashan. So we have, even if patients go off island, we encourage people, when you come home, you're kind of a fish out of water after most likely being gone for months at a time, that you reach out to our local oncologist, if for nothing as a support, even if your long-term plan is with Sloan or Cleveland Clinic, and Anique can speak to the specific, there's a local government insurance that Anique can speak to, that they work with local hospitals that will, but Anique can speak more kind of to the MAP program and what that offers cancer patients.
So if somebody presents with cancer and they need financial help, first of all, how do they contact Cancer Support of the Virgin Islands? And then what is the process to receiving this funding? And how much funding can they expect to receive?
Great question. So if someone has cancer, you can definitely call my number, or for more information, overall information, you could go onto the website, www.cancersupportvi.com. You will see my contact number, but I'll just say it out since I'm online, 340-514-8647. If a person comes to me with a cancer diagnosis, it's very, very easy, very, very seamless. We know individuals have challenges, and we're not here to bog them down with a whole lot of paperwork. It's a very simple application, and we ask for that to be completed along with a copy of their pathology report, which confirms the diagnosis. That is processed that same week, and a check can be put in the mail that very same week. Currently, a non-insured individual can get up to $3,500 in a financial grant. If you have insurance, private insurance, Cigna, whatever insurance, that is a $200,000 grant. And for anyone who has a medical assistant or MAP through the government, they can qualify for up to $2,500 in a financial grant.
Okay, did I hear you say $200,000 grant just now?
I apologize. 2,000 for insured patients, 2,500 for a MAP patient, and 3,500 for an uninsured patient. We don't turn anyone away once you have your qualifications.
Okay, understood. And so is this a one-time grant, or if the cancer persists or recurs, can they get another grant? How does that work out?
So when a patient comes to us, it is an annual grant. So you get one grant for the year. If they find themselves in the situation the following year and they need additional assistance, we just require them to provide some type of documentation from their doctor stating that, hey, I am still in active treatment, and we will go from there. We don't ask them to submit pathologies again or even reapply, because we have that information on file.
Okay, that's great. So it makes it really nice and streamlined for the
Correct.
patient and pain-free. And so, Anique, are you on St. Croix or St. Thomas? Do you have a counterpart on your opposite island?
No, I am based out of St. Thomas, but we service everyone, St. Thomas, St. John, St. Croix, and even Water Island.
Okay, so this can be done virtually. They can email the documents, speak with you over the
Absolutely.
phone.
Absolutely.
No
And one of
need
the
to come in.
process, I'm sorry,
No need to come in
because
in person.
of COVID, it's, so many things have went remotely. So I usually, once I get a phone call, I will ask them for the email address, and I will provide them with all the documents that they need. I know not everybody has email. I will avail myself at times to go to the office to meet with a person or a patient to follow out the proper paperwork and just to get it moving. Again, these individuals find themselves with a diagnosis, and with COVID, some folks work from home, some folks don't have the necessary tools to communicate remotely. So whatever needs to be done, we avail ourselves to definitely help our cancer population.
Okay, excellent. And so how many years has this organization been going on again? We mentioned some fundraising
so-
prior to Irma Maria, but
Right.
How many
So it
years?
started in 2005.
2005.
So yeah, so I guess I do the math. I guess is it
17 years?
Yeah.
Yeah.
17 years, great.
And, right. And so I think it's important to note it is an annual grant. However, Anique will assess every patient that comes through. And I think it's important to note that we treat every cancer patient uniquely because they are unique. You and I might have the same type of cancer, but our treatment protocol, the way that, our process is very different. And certainly Anique can speak to the massive challenges that people endure. I call it endure because it takes great courage to, not only are they leaving their home island, most often they're going to family. And imagine during COVID, having places to go, or they're being asked to stay in a hotel. We had one gentleman a couple of years ago. Anique, how many months? Was it 6 months?
It was almost a year. It was quite a long time, about 8 months or so that he was off island.
And his wife is a teacher, had 2 small children that was with them. I mean, it's hair raising. Again, we could tell stories that would be impactful, but it's also very personal and private. We have that one woman in St. Croix where up until recently, her food stamps weren't being accepted. Why does she have to worry about that? Isn't that federal funding? Or, I think as much as we just simple and clean provide a financial grant, Anique is she's not asked, she very wholeheartedly listens to kind of the challenges. How about the cancer patient, Anique, or the gentleman that's in Florida with his brother, where he had to go to Florida because, and he couldn't
There
go.
was no care here. Yeah, there's no care on island.
Here, and he couldn't go unaccompanied. So the brother went because the wife just finished cancer treatment. Seriously. Do you know what I mean? We're asking people to navigate, and the challenge is, I think the one thing that our organization has been able to do over the last 3 years is not only increase awareness, but we've been able to bridge the gap more than ever. And when we say that, we spearheaded starting the U.S. Virgin Island Cancer Coalition. We went to the nonprofit organizations. There's the YAG Foundation on St. Croix. There's Ribbons for a Cure. There's the American Cancer Society. And there's the St. John Cancer Fund. And so although we all raise funds autonomously, because we are different. We give 100% of the proceeds. We can't, that's just our mission. But we started this coalition, and within that, we created this amazing patient resource guide. And we can provide that information. But the patient resource guide, we give out to pharmacies and doctors' offices. And it full on shows, it's a booklet that includes every support that's available in the Virgin Islands for cancer patients. So that's pretty amazing. We are 18 months out from, and whoever's listening today, we are 18 months out from the cancer center reopening. 18 months in construction world means another 2 years, maybe. And they are still navigating what is going to go into this cancer center. So in the meantime, that's 2 years that we're continuing to ask cancer patients to yield, most likely to going off island. These St. Croix cancer specialist, Dr. Hobdy and St. Thomas and Dr. Bashan, they all provide chemo, but we don't have radiation. Radiation is essential. We're probably not serving about 3,000 patients annually, I was told recently, in some sort of radiation capacity. So we know that the governor, Brian, it's his number one priority to get that the cancer, Charlotte Kimmelman Cancer Institute reopened. It'll be the first of the 2 hospitals, I believe, or the 3 that will hopefully, reopens. And it begs to differ. Over half of what we raise goes to the island of St. Croix. I think it's important to note that. We've just really begun to make an indelible footprint over there. We've created a task force over there. We want to understand what each island is faced with. What's it like for a cancer patient on St. Croix where they don't have a pulmonologist and that person needs to get a lung biopsy? What if they're not well enough to come to St. Thomas?
Right.
Where are they? So it's not just the limitations of a cancer center, it's certain services that a cancer patient is asked to, sort of navigate. So we're super grateful that we're continuing to find a voice that maybe hopefully can see where those gaps are so that we can fill those gaps so that people aren't left out to their own devices. Oftentimes people won't come. Sometimes people come to Anique and they're stage 4. They're too prideful to ask for help, or they're assuming they have no insurance. So who's going to help them? And we're really only just one grant. But at the end of the day, an uninsured cancer patient, as Anique says, gets $3,500. With every patient, she ensures that there's an application for the American Cancer Society. They provide a grant for, I think, Anique, it's up to $800, but I think it all is, and their process is very, 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 very different. We believe there's only one cancer patient. However, we can provide as much for that one cancer patient. We're going to reach out to everybody and ask.
And so, Anique, talking about helping them to make the connection with the American Cancer Society, what other services does the Cancer Support Group do other than giving the grants? What else do you help patients with? Do you help them to locate an oncologist or a place to stay when they go to the mainland? What other services?
Definitely. A couple of things. So with American Cancer Society, they have the Hope Lodge. Many people, a large percentage of the cancer patients have to travel off island. And many times, you have some that have family. And even when they have family, they're calling, asking, I'm going to Tampa, what's available. So with the American Cancer Society, there's the Hope Lodge. They have them in a number of the United States, and we will provide them with that information. We also let them know about the resources that's available on island, which is very, very helpful. Sometimes folks have a diagnosis and they just don't know where to start. Barb talked about the USVI Cancer Coalition. We have a resource guide. What we were finding about 1.5 years ago was individuals was coming to us and you have different patients asking the same questions. So we wanted to create something with other nonprofits to give them something in their hand. We were able to distribute this both on St. Croix and St. Thomas to the oncologist office, to the pharmacy. So that's getting out. The word is definitely getting out there. And we recently started a support group with a handful of women for breast cancer, and it was overwhelming. It was a success. These individuals were different stages. Some people just diagnosed, some individuals diagnosed for 15 years. But the connection that was there about this cancer and the treatment was phenomenal. Like Barb said before, we're very, very small, but we are still here to support in any which way. And if there's things that we don't know, we try to resource that, we do the research for that information and pass it on to the cancer patient. So.
Okay, those are all very important resources because sometimes you just don't know where to begin.
Absolutely. Absolutely.
Yeah, it's a daunting situation. I myself am a cancer survivor.
Okay.
So I can certainly understand the challenges and the fears.
Right.
Those deep fears for your health, the deep fears for your life, that can almost be paralyzing.
Absolutely.
And, a resourceful person can almost become an unresourceful person all at once because they just don't even know how to even begin the research because of the whole emotional crisis.
Absolutely. And it's funny you said that because fast forward to 2020, a lot of patients, they resorted to stay on island because they were just fearful of the pandemic. They were like, my immune system is already compromised. I don't want to travel to my doctor for, checkup. So a lot of them stayed, and some were able to get some limited treatment, and for some, they just had to wait and ride out. So I noticed in 2022, this year, a lot of those patients that missed their treatment in 2021 were back, and they were like, I missed it for the whole year, but I got to get off to my doctor. So yeah, it's definitely
Yeah.
a challenge.
Yeah, for sure, for sure. And when it comes to your fundraising, how do you accomplish that? What kind of fundraising do you do? How do you raise those funds?
Yeah, it's a great question as well. As I mentioned before, because of the pandemic and the hurricanes prior to that, we've had to get really creative because we couldn't, as a healthcare, we couldn't really involve ourselves over the last 3 years in us being the host of an event. So, for example, we reached out, we do something called Give Cancer the Boot. I don't know if you remember the Jerry Lewis telethon, back when the firefighters always had the pink boot. So a couple of years ago, I reached out to Hunter Boots, and between Amazon and Zappos, I think we have 30 or 40 boots. And so we go to schools and we go to the fire station. A couple of years ago, the firefighters and their kids went out in the middle of the road and garnered, whether it's coins that they're dropping in or whatever it was. Those are kind of the things we are, Pinktober is the largest, Pinktober, Breast Cancer Awareness Month nationally is the largest fundraising month in the country. So we take advantage of that. We raise money for all cancers, but we primarily focus, everything is pink. We unleash Pinktober. Last year, we thought, what are we going to do? And so I came up with the idea of asking some of our donors, larger donors, maybe we can come up with $10,000 donors, start the month off with $100,000. Every dollar will be matched up to 100. People love to know that their dollar is really $2. And we started the month, or it was the 29th, and we had $90,000, and we went to a realtor in Sharon Huprich with Calypso Realty, and she yielded to say, I got you, Barb, and went to and asked 10 realtors. We actually got 11 realtors. So we started the month off with $110,000. Every donation raised in the month of October was matched last year. So we raised almost $240,000. We did that thanks and only thanks to our small businesses. We just couldn't do it without them. For example, we have, and this year we're partnering with Leatherback. Leatherback Brewery is doing a pink beer. It's actually a pink soca, which is really incredible. So a portion of the proceeds throughout the month with the sales of that will go. We're partnering with bars and restaurants.
We've just run out of time. I hate to interrupt you, but we're right up to our time limit. So we look forward to having you again on another show to tell us more about this.
Yes, please.
And for our listening audience, please do contact them at cancersupportvi.com or .org?
.com.
Cancersupportvi.com if you're in need of financial assistance for cancer treatment. Again, Barb and Anique, thanks so much for being on our show.
Thanks. Thank you.
Have a great day.
Take good care.